What is the HIV and what's the AIDS? What are the symptoms of the HIV, how we diagnose it? Today we talk about all of them.
AIDS stands for Acquired Immune Deficiency Syndrome. It's a severe and advanced stage of the infection caused by the human immunodeficiency virus. HIV attacks the body immune system, specifically CD4 cells, which are the crucial of fighting off infection. As the virus continues to replicate and destroy this cell, the immune system becomes severely weakened, making the individual vulnerable to various opportunistic infections and certain types of the cancer. First identified in 1981, AIDS destroyed the person's immune system, resulting in virtual death by the disease that the body would usually fight off. AIDS was the first observed in the American gay communities, but is believed to have developed from the chimpanzee virus from the West African in 1920s. HIV is primarily transmitted through certain body fluids, such as blood, semen, vaginal fluids, rectal fluids, and breast milk. The common method of the transmission includes the unprotected sexual contact with the infected person, sharing the contaminated needle or syringe, receiving the infected blood products or organ transplant, and from an HIV-positive mother to her child during the childbirth or breastfeeding. HIV cannot be separated from the sweat, saliva, or urine.
Doctor, explain the stages and what symptoms on these stages.
Yes. Thank you so much, Daniel. The first of all, I need from anyone to understand what's the disease, this disease. First of all, I need to talk about HIV, human immunodeficiency virus. This have three stages, three problems, three what we call periods: acute, chronic, and advanced. In case of acute, for this HIV, that means like flu symptoms, signs and symptoms. Flu-like, that means there is fever, there is problem, there is pain, there is swelling of some lymph nodes, there is arches in muscle, there is some early signs and symptoms. But when we go to the chronic, in this disease, in the HIV, the problem is latent, we call it. That means there is no any symptoms in this stage. This is the problem. This stage may be so much years, maybe decades, 10 years, 20 years. This problem in the case of chronic, because there is here latent stage. There is no appearance of any disease. After that, this is the problem we call advanced stage. In advanced stage, there is, we call AIDS, acquired immunodeficiency syndrome. This means the problem in the immune system. The immune system here may become weak immune system. Here the problem, rapidly lose of weight, lose of memory, lose of, and also really it is a problem, this stress problem. This one becomes stress, become not understand this, become lymph node swelling. This also a big problem. That's mean enlargement of the most important of lymph nodes. Fever, tired, unexplained lose of the weight, not understand why with this. This we call acquired immunodeficiency syndrome. After that means the last stage of the HIV developed to this stage. That is what I need from anyone to understand about the HIV and the AIDS. When we talk about AIDS, we must understand the HIV, the human immunodeficiency virus, and this go to acute stage, chronic stage, and advanced stage. Problem in this disease is the chronic stage. In case of a chronic stage, there is no any symptom. The virus go to the latent, to go in some type of cells. Particularly, especially in the cells of immune system, in the cells of the central nervous system, and so on. This is the problem with the AIDS and with this type of disease.
Thank you, Doctor. Thank you so much, Doctor. Doctor, how about does AIDS can cause the death to human or not?
Thank you so much. Really, AIDS or HIV itself not cause the death for the patient itself. It is a problem in the immune system, but itself not. The problem in the AIDS, what we call AIDS-related infections or diseases. That means there is some diseases attached with the AIDS, with the HIV. This is the problem. As I talk with you, Daniel, there is some diseases called AIDS-related diseases. This like pneumonia. Pneumonia, you understand, one of big problem, inflammation of the lung. Like tuberculosis, that's mean one of important disease caused by TB, TB caused by different species of mycobacterium, tuberculosis, mycobacterium bovis also, but this on of. Also maybe because of the meningitis, inflammation of the membrane of the brain, membranes. Membranes, you understand there is different, there is the 3 layers of membrane. These layers, when inflamed, we call it meninges or meningeal inflammation of this layer. This problem also lead to this cause. That means there is some diseases related with the AIDS, related with the HIV. This is the problem, Aini. And there is also another important diseases like candidiasis, infection by candida, fungi, not bacteria. Toxoplasmosis, tuberculosis, as I talk with you. This is the cause of the disease. But itself, not cause, but sure there is, from the name, immunodeficiency, the problem in the immune system.
Thank you, Doctor. Good information. Thank you so much. Doctor, how about the treatment? Why we cannot treatment we don't have any treatment for the AIDS?
Well, this is really the problem in the mutation of the virus. You understand the mutation is quickly. So there is a problem in this point, and there is another problem in the reservoir of the virus in the cell. As I talk with you, go to latent, go to be in some cells inside the body, inside the CNS system cells, inside the immune system cells. So this is a big problem for the treatment, particularly about the mutation. This. Until now, there is what we talk about, the progression of the research, inshallah. We hope scientists globally, inshallah, solve this point. But still, it is a problem.
Thank you, Doctor. Thank you so much.
Thank you for you also. Thank you. Thank you.
HIV test used to determine whether an individual has been infected with the human immunodeficiency virus. There are different types of the HIV test. The first one, antibody test, antigen test, combination antigen and antibody test, nucleic acid test. This test detected the presence of the antibodies produced by the immune system in response to HIV. Most antibody tests are performed in the blood sample, but some can also use the oral fluid or urine.
It's important to note that it takes time for the body to produce the detectable level of the antibodies after the HIV infection, so these tests may not provide accurate results during the early stage of the infection.
Check the presence of the HIV antigen, which are the viral protein produced by the HIV itself.
Antigen tests can detect the HIV infection earlier than the antibody test because they can identify the virus itself rather than waiting for the body to produce the antibodies. Combination antibody and antigen tests. These tests look for both HIV antibodies and antigen, providing dual detection the method. Combination tests can detect the HIV infection earlier than the antibody test alone.
These tests directly detected the genetic material RNA of the virus in the blood.
A nucleic acid test can detect the HIV sooner than the other types of the test. This test should be considered for the people who have had a recent exposure or possible exposure, and have early symptoms of the HIV and who have tested negative with an antibody or combination antigen and antibody test.